We can't afford daycare or Medicaid. We're funding wars.
So yeah, I mean, that video is crazy. Like, America, even if you're like left or right, like you can be both sides of it. I think we can all agree that we're spending so much money on these wars and all these things out there, right or wrong. But in doing so, there's a real problem inside America for like healthcare.
Absolutely. How many people do you run into weekly who say to you, I have coverage in another country, or like I would go to Mexico to get it done, or like,
yeah,
I'm Canadian, I'll just go back to Canada.
I'll get my dental work, I'll go across the
right,
border,
like if anything happens, I'm just gonna go somewhere else. Like, that's terrible, because we have amazing providers here. I don't think it's the providers necessarily where the trouble is. I think it's American healthcare and like where we're allocating those dollars. Now, I do think that the Medicaid is important. I mean, I think that there are certain people that need that help, but I also think that it's potentially, as with all government like programs, there's the potential for it to be taken advantage of. And so unfortunately, honestly, there's just a few people that are kind of ruining it for the rest of everyone, right? And so this is part of it. Like, I don't know.
Well, yeah, like they were talking about like other countries giving away for free, but there's a real big divide between Medicaid, like when the cutoff is, and like the credits that you get on Obamacare. Like, it's typically a couple $1,000s to $5,000, but so many people can't get on Medicaid or they can't get credits. Like, they're in this weird like loophole phase. Have you seen that?
Oh, absolutely. Where you're just kind of stuck in the middle, and you're going in and getting denied for Medicaid, and then you're also not able to take the marketplace, and you're not subsidized, and your income's at this weird level. Like, there is that kind of gray area, besides people being totally affected by the reduction of the advanced premium tax credits and all of that disruption, right? There's just so much chaos, and it's so broken.
Yeah, for sure, 100%. And all these private insurance companies are making like billions of dollars, from people paying in. And so it's kind of a jacked up system. Do you think the government should be spending less money in wars and outside and putting more money back into America?
I'm kind of anti-war, period. Like, I just, my son's in the Navy, so I don't ever want us to be at war. And I also like some of these countries that have literally lived in conflict forever, right? Like, you go to work and there are gunshots around you. Like, that is insanity to me. So, I don't think that some of this stuff should be political, but clearly it is. Like, you feel a difference in this country depending on who's in office. So I don't know. I mean, I think it's a broken system. I think we are trillions of dollars in debt, and one of the most expensive things is to have another war. Like, that's very costly. But I just think that there's got to be a better way. Like, I run across people weekly, daily, who need coverage and can't get coverage. Like, they are in that weird kind of vortex that you're describing. They don't have an employer option. They're disabled in some way. Like, there are so many people that need help. Yeah. And sometimes it makes you wonder if it's not like kind of Darwinistic. Like, it's the survival of the fittest. Like, if they're not trying to thin out the population in some way by not caring for all of our citizens.
Yeah, and here's the crazier part. Like, in the States, like, if you get declined or dropped from Medicaid because of all these new laws, they only give you 60 days to get on a marketplace plan, right? Even if you get credits or not. And so if you have a major health condition and you don't see the letter or the notice from Medicaid with it, and sometimes they don't send out these notices, they only give you 60 days to get on. And if you miss that window, then you could be stuck a whole year or 9 months without like the medications that you need covered or seeing the doctors you need to see, because private plans outside the marketplace, most of them don't cover pre-existing conditions, or they're like 10 times the amount of price because that person could get credits on the marketplace.
Yeah, for sure. And I mean, ultimately, I don't know. Again, there are definitely people that are taking advantage of that system. That is unfortunate. I think if potentially we had like maybe some better parameters, or there wasn't so much gray area, that we'd have the right people on it. Yeah. Like, I see people all the time that also shouldn't qualify for Medicaid, but they do, right? Because there's, again, these weird loopholes in our system. And that's just more money that the government is bleeding, that we're covering people that really could get coverage by other means.
I would say probably the craziest state, no shade against Washington, shade against if you like Medicaid, no shade if you do like Medicaid, shade if you don't like Medicaid out there, whatever your stance is. But I remember this family, they were making like 130, 150K, somewhere in that range, and they qualified for Medicaid. You know, which is that's like in a lot of states, or that's a lot of money compared to mostly the range between like 10 to 30,000, like below 20K.
Well, but I mean, if you're going to talk about that, you have to talk about the fact that advanced premium tax credits, like as much as everyone was up in arms about the enhanced premium tax credits going away this past year, that was another really big part of the problem. Like, you had families that made really substantial incomes that were being subsidized for healthcare, which was putting us further in debt. And it went on for 5 years past COVID, because it was part of the COVID relief package, right? And so you had all these people that absolutely were back out in the workforce. They were way past the COVID thing, and they were still being subsidized. And we let it go on for so long. It was like 5 years past COVID actually being a thing. And that's, again, trillions of dollars that were in debt further to pay for people that really could have paid for their own health coverage. So
that too, and then just the amount of abuse and like fraud that's gone in the ACA of people being fraudulently signed up, and the government is paying $500, $1,000, $2,000 a month, like per person. And so there is just like hundreds of millions of dollars going out in fraud that's just being wasted.
Yeah. And how many people do you run across that didn't even know they had been enrolled in a plan? Like, it's really...
Well, then that's why a lot of Americans say, like, hey, we should clean up things that happen inside the States before we try to go, like, deal with, like, another country.
Well, it's yes. And I think that it's very interesting, peculiar, that the government's even involving themselves in healthcare. Like, it's really supposed to be a state level legislate, like that's where it's supposed to be decided. But you've got this blurry, like, the state is managing it, the federal government now has a say in it. Like, it's all just so muddy. It's I don't know how else to put it.
Yeah, 100%. So what do we do at the Benefits Boss? Like, what do we do to help people in these, if they're trying to qualify for outside Medicaid or for credits or for private plans? What do we do? And
so I think the most important part of what we do is we spend enough time with people to give them an honest answer about what it looks like, right? Like, you know, I have people all the time that I engage with that they don't understand the subsidy calculations. And so whatever they put in on their taxes, like as their estimated income, they've done it incorrectly. And they're subsidized up front. And what they don't realize is that's an estimation of what your income will look like for this year that you're in, right? So by the time you go to file taxes next year, if you've misestimated it, you're going to owe a bunch of money back, right? I just had a lady this week that came to me and she's like, I had a huge tax bill because I had stocks and I had this and I had that and I didn't know. And, you know, there's so much just to understand there. And so I think that's number one. I feel like on a regular basis, clients are telling me, like, thank you so much. I'd clearly done this wrong. I had a lady yesterday that's in Arizona who told me, you know, we qualified for a subsidy. And I said, that is surprising to me. Let me go recalculate this and put all the same information. And then they didn't qualify for a subsidy. And she thought they were going to be subsidized by like $600 a month. So that's a huge tax liability.
Yeah, it's like
$7,200. Yeah, it's like a lot of money. And so ultimately, that's the first thing that we do at the Benefits Boss is we spend the time with them to make sure that we're calculating things correctly so that it doesn't give them any unpleasant, unexpected surprises come filing their taxes. That's number one.
Yeah.
Number two, I think we've spent the time ahead of them even in anticipation of them coming to us to find the right plans, right? My favorite thing about what we've built is that legitimately every single person that I encounter, I have a solution for. I have a way to make their situation better. Whatever that's going to look like. If it's we're going to find something from now until the end of the year, and then we're going to revisit the marketplace. If it's the marketplace today, plus supplements to cover, whatever it is, we have a solution for every single person that we encounter. So I think that makes us very different from most agencies that are out there.
Yeah, 100%. What should people put in the comments down below? Like, if you guys are struggling with this, like wherever phase you guys are in life, right? Like if you couldn't get on credits because you were right in the window, if your plan is $2,000 a month, put down in the comments down below. And
I mean, just say, help me, like help me, because help looks a variety of different ways when you're dealing with this, right? It could be you got hosed and on your subsidy and you ended up dropping coverage and you have no coverage right now, or you're going out on your own, or you're anticipating going out on your own and you don't know where to go for coverage. Like, so many ways that we can help you in an advisory, consultative kind of manner and make your situation better. So just put help me and let us help you, because it always pays to work with an expert.